there are differences that need to be considered between medical and surgical. And what we know from the research and what my experience would back up is that for some women, they could do either and it really wouldn't make much difference to them. Others are really very strongly wanting to do it one way or the other. And so we really do have to be able to talk about the differences. So to my mind, when I talk about the medical abortion, the things I bring out there are to say it's very private. You can have that in your own home. It's more under your control, the timing. You can fit that timing around other things in your life. You may or may not have to take time off work. Many women see it as a more natural process, and particularly if they kind of understand that it is bringing on a miscarriage. It's generally now more accessible. In other words, there are a lot of different providers, particularly your own GP may provide it, so you may have to go nowhere different at all than you would go, which adds to that sort of sense of privacy as well. But it does involve that bleeding and cramps, and the bleeding that may go on for a few weeks afterwards. It involves more visits to the provider generally, and I guess for some women it's just an experience that they don't want to go through. So some women like to go through that experience in their own way, in their own time. There are others that would prefer to be less involved. With a surgical abortion, women generally have a light sedative for that, so it's quick, it's a one-stop shop, and it's something that they're asleep for. Generally, the bleeding that occurs after a surgical is less than after a medical, and there is less chance that the abortion won't be successful. With medical abortion, there is something like a 2 to 4% chance that the process won't be completed with medication. So there is that important thing with a medical that ultimately we can't say for certain that surgical procedures won't be needed after, but it's not very common.
So surgical termination of pregnancy is, of course, a surgery. And with surgery comes sedation. So we do have to accept that there are small risks with having a sedation. But in general, our population, by their very nature, are young and healthy. So those risks of sedation are very small indeed. Along with those risks of the sedation comes a sort of the inconvenience factor of a sedation. So when you have a sedation, you're not actually able to drive for 24 hours after the sedation. And that has an impact on the ability of perhaps getting to work. It means that you will have to have someone bring you to the hospital and someone to take you home from the hospital. And being a surgery, there is a time aspect involved. So you do have to dedicate a day to have this all done, and that can involve taking a day off work. So that's really talking about the sedation aspect. From the surgical aspect, there are some obviously unique risks from a surgery. Those risks are very small, but need to be discussed with the patient. The first surgical risk is perforation of the uterus. So this is causing a hole in the uterus with the instruments that you are using. Now, to be fair, in most cases, those perforations, particularly if they're small, will heal on their own without any complications. But a small number of those patients will require to go on and have further surgery to repair that hole. But that risk is very small indeed. Happens approximately 1 in 1,000 cases, and often there are predisposing factors to it occurring. So another risk with surgical termination is cervical trauma or damage to the cervix, and this would happen during the instrumentation process. This can cause some damage to the cervix, but again, it is an exceptionally small risk, happening in less than 1 in 1,000 cases. So those are the risks unique to a surgical termination. The risk of infection is similar for both a surgical and a medical termination. You then have to consider the pain and bleeding differences between a surgical and a medical. The medical termination can be quite painful for some people, And they have to go through this at home using oral analgesia. The pain with a surgical termination is quite minimal. It's very well managed in the immediate post-operative phase, and patients within 30 to 45 minutes will be able to leave our clinic essentially pain-free or with a very, very low level of discomfort. Bleeding is also different in that bleeding with a surgical termination is generally quite light and doesn't last too long. And in some patients, they actually have no bleeding at all after a surgical termination. You have to compare that to a medical termination where the bleeding can persist for a number of weeks until it fully settles. While those aren't risks, those are factors to consider with both the aspects. Those are sort of known events that are going to happen. The other risk that we look at is that of retained tissue. So that is where not all of the pregnancy tissue comes out of the uterus. And we don't always understand why this happens. With a surgical termination, the risk of retained tissue sits at approximately 1%. With a medical termination, depending on the literature you read, this risk can sit at up to 5%. And those patients with retained tissue can require sort of prolonged care. They may require further medication, or they may require further operation. So those are sort of factors to consider when you're choosing between a medical and a surgical termination.
Another factor to consider for her is what's available to her in her own community. In rural and remote areas, women don't have access to surgical terminations for pregnancy and have to travel a long way. So if their pregnancy is in the early stages where medical termination is available, well, she's probably going to be more likely to consider that because that can be accessed hopefully through her GP or hospital system or through a telehealth option that is available in Australia. The other consideration, sadly, is the woman's safety and is there any reproductive coercion going on in her background. I've had many patients whose partners won't approve or encourage or support her through a termination of pregnancy. So with a medical termination, it can be seen to be just a miscarriage, and that is deemed by the partner to be, a feat of nature and nothing that the woman actually created or caused to happen herself. So again, that's not an uncommon factor when women choose medical termination.
In terms of cost, surgical abortion on the whole is going to be more expensive than medical. Medical abortion costs vary hugely. There is the cost of the medication, and depending where women sit on terms of PBS subsidies, that's anywhere from about $40 for those medications down to none, no cost at all. If a woman, for instance, is on a Centrelink benefit and is Aboriginal and or Torres Strait Islander, then the cost of the medications is zero. No cost, but the cost of the actual consultations varies. So there are pros and cons for each, and I find that women fairly quickly self-select which is going to be more suitable for them.